Aphrodite. We have a few bumps in the road here. Hold on a second while I adjust the volume on Tin Man. And we are live. We are live at WLCB, Slade's Corner, Wisconsin. My name is Bill Miksch. I'm president of WDMA Financial Group, and I am back in the chair tonight at 6 o'clock Central Time. We are down an hour, so it is dark when we go to work, and we are dark when we go home, for most of us at least. Welcome back, everybody. We needed a break in a bad way. If you saw my schedule, I'm not bemoaning or complaining or anything like that, but I've got a pretty healthy schedule, and so I finally took a short break. It was a partial birthday present from my son Trevor. Both Trevor and I went to northern Wisconsin to enjoy some fishing. We got the typical northern Wisconsin weather. Rain, cold, a little bit of snow, nothing stuck, of course, but we also went fishing. And on Friday, I've only caught one muskie in my entire life, and Trevor's never caught one. On Friday, we got 6 muskie to the boat, and we put 3 in the boat. Trevor caught his first muskie. Is very cool, 35 inches, 9 pounds. And then about a half hour later, I hooked into one 42 inches, 20 pounds, which was a hog. And then 2 minutes after we got that fish in the boat, literally, another one hit my other line. And we had to struggle to get the big fish out of the net, and I had to mess with the other fish. We managed to get both of those fish in the boat. And there are pictures of me on my Facebook, my personal one, showing 2 big fish on either hand. And let me tell you, the big one, you had to be very careful because the teeth were at least, I don't know, ½ inch to an inch long, maybe ½ inch probably. But a muskie, for those of you who don't know, it's kind of like a barracuda in freshwater. Big fish, ugly looking, mean looking, and we like going up at the end of October because the water has turned over and the big fish are gorging themselves because they know the ice is coming. So we got really lucky, and so it was a great time with Trevor. Unfortunately, my son Randy was in Florida. He couldn't make it, and Ryan works for Barstool, and he was very busy. And Sally didn't want to come, so that's all good. Trevor was able to get away with me, and so I appreciate it, bud. Thanks for coming with. And thanks for the birthday gift. I greatly appreciate it. But we're back. And tonight, I did waffle, I must admit, ladies and gentlemen. I waffled on whether or not I was going to have the show because it is election night. And I knew intuitively I may not get a lot of listeners because everybody's going to be glued to the table. But the truth is, nothing's going to be really announced, at least locally here, for another hour. But the polls are shutting down on the East Coast, so there will be some trickle-downs that are coming in. So I decided yesterday that instead of doing a continuation of retirement and annuities and all of that stuff, which we're going to continue starting next week, we're going to do elections and insurance, and how elections have a causal effect on what insurance might look like, taxes will look like, estate taxes, how healthcare is handled, etc. And so I'm going to be very careful, and hopefully Sean will be joining me here shortly. If he doesn't, and I don't know if he's ringing in or not, I can't tell. I'll put my cell phone out here just in case he tries to call me up, because I don't know if he's going to be on or not. But if Sean is not able to call in, our phone number here is 262-342-6588. What I was going to say, though, was this is not a political show, and I'm going to try very hard not to make politics out of this, because that's not my intent. But as a famous politician once said, and a lot of them say this now, elections have consequences. And we are in a different environment than we were 10 years ago, let alone 20 or 30 years ago. So we're going to talk about how elections have consequence or effects, causal effects on taxes, estate taxes, healthcare, and other insurance matters. And just so you guys understand, I'm having this is what happened when I got in this morning or this afternoon. The plug was somehow disengaged from the microphone, and I'm not quite sure how it's supposed to go in here. I don't know if it broke off or just what, but it was clearly disengaged from the unit that it's normally sitting on. Long and short of it is, I may be holding this microphone for the entire show. So we'll see how that goes. It seems to be working okay at the moment, but we'll see. So let's just get right into it. So, elections. I don't really care what side of the fence you're on. It doesn't matter to me. Health insurance and insurance in general does not have any political swaggart. In other words, it doesn't care if you're conservative, liberal, progressive, Democrat, Republican, Libertarian, Green Party. It doesn't matter. Insurance is insurance. Insurance is based on contracts. And insurance companies collect premiums in order to pay when a claim occurs. But what happens over time is that understandably, certain things happen in the marketplace. People get upset, understandably, and in some cases rightfully so, and complain to their politicians that this is not fair, this should be covered, this is not fair, this should be covered, etc. Let me give you an example. In the state of Illinois, right now there is a state mandate that says specifically in vitro fertilization is a covered expense for groups 25 or more, I believe. It may be 50 for sure, but I think it's 25 or more. Truth of the matter is, it's also baked into the Affordable Care Act kind of plans, which are actually down to 2 people. And there's a limit of 4 that a person can have. And there's some argument as to whether or not it's a limit of 4 per lifetime or if it's a calendar year. So there is a item on the ballot in Illinois to make unlimited in vitro fertilization. Now, remember, elections have consequences. So if this law passes, or this provision passes on the ballot, it may very well become law, which is a mandate to the insurance company to make sure that any insurance company that's licensed in the state of Illinois, and let me be very clear, it does not include self-funded or partially self-funded insurance programs. This is mostly for the fully insured space. And there's not too many carriers left in the state of Illinois that are doing fully insured. And just to be clear, what that means is you pay a premium to the insurance company, and the insurance company pays a claim. You don't participate in any of the savings or losses. You don't participate in the claims. You don't participate in getting money back if you had a good year, et cetera, et cetera. It's that they collect the premium, they pay the claim, period. Putting no limit on in vitro fertilization from a, let's say, a moral standpoint, and from a human being standpoint is, yeah, why not? That's a good idea. But the last I checked, insurance companies are not in the business of charity, even though they do a fair amount of charitable work. No two ways about it. That's true. The truth of the matter is they're simply a pass-through between you and me as consumers, or the employers, and the providers. So if a government edict comes down or a mandate comes down that says you have to do this, The underwriters and the actuaries and the owners of the insurance companies will get together and hash out what they think that's going to look like from a cost perspective and increase the premiums accordingly. It won't be complicated. It's simple math. It's no different than increasing a tax or a tariff on an employer. Businesses and business entities don't pay those taxes. They do, but the truth of the matter is they push that tax forward towards the consumer. So this law, while it on its face is, yeah, why not? Lots of families, lots of couples need help trying to have babies these days. Truth of the matter is, my wife and I went through that exact thing, but we didn't have insurance policies to help us. We had to pay for it ourselves. It wasn't cheap. It was very expensive. We got lucky. Lots of people that I know, either casually or more personal, have tried and have not had any successes. So this state law is going to be, if it passes, going to be put in place, and the cost of that care is going to be pushed in the form of additional premium. Is that a good thing or a bad thing? That depends on your perspective. I can tell you right now, insurance policies are not going down. In fact, for January 1st renewals, folks, my average increase for my small and medium-sized employers is between 12 and 18% this year. A couple people have gotten single digits. I've got one sitting at 25%. And I'm going to just talk about that one for a second. That particular group is not getting it's actually a 24% rate increase. They're not getting a 24% rate increase because they had a bad year. They're getting a 24% rate increase because the pool that company is associated with the insurance carrier they're insured by, the pool is running poorly. The pool is running poorly. So the whole pool is getting whacked with the 24% rate increase. And there's nothing the employer can do about it except to bid it out and see who else comes back with a better option. And we're optimistic about that. But if you're getting hit with a 12 to 20% rate increase, where's that money coming from? That has to come from somewhere. That's no different than a tax. And when the government starts to make mandates on the health insurance side, that's not going to do anything but increase the cost of health care. We talk about access and affordability. There's no secret that I don't feel that the word affordable in the Affordable Care Act is a fair way of defining it. The average out-of-pocket cost in the Affordable Care Act space is $9,450 for calendar year 2025. There's a few plans that are less, but you pay a large premium to get the better plans for sure. But the average out-of-pocket is $9,450 per person. And the target audience, folks, is your younger people that don't make more than $30,000 or $40,000 a year or less, and those people are gonna, or families that are maybe making, family of four making $70,000 or $80,000 a year, they're going to get what's called a subsidy on their premium. And that sounds really good. Again, sounds really good. Those people that instead of paying $1,500 a month in premium, maybe they get $1,000 subsidy, not a rebate, but a subsidy, where the federal government, and I'll get into the specifics on this in a second, will subsidize that premium, and so that family, instead of paying $1,500 a month, may only pay $500 a month. But they have an out-of-pocket of $9,450. Now, they have affordable health care, but that subsidy, folks, is not a gift, it's a loan. And the subsidy is based on a prognostication of what you think your income is going to be. And we're talking the individual market here, just to be clear. You're prognosticating what you think you're going to make for calendar year 2025. I can tell you, whenever I have a client that sits down and we go through the subsidized portion of getting health care, I tell them straight up This is a loan. It's not a gift. And if your income rises, you will have to pay some or all of that subsidy back. And I can tell you firsthand, I've had clients come back to me and say, I know you told me, but I can't believe it. I got to pay $9,500 back to the government because I made too much money. That's fact. So, was it affordable? In the short run, it was, but when you filed your taxes, your income all of a sudden spiked or something happened, and that's a good thing from an income perspective, but you forgot about the fact that you got a gift, ergo a loan from the federal government that you had to pay back in the form of a payment back to the government to pay that subsidy back. So, was it affordable? Not so sure. Does everybody have access? Yes. Private practitioners, because running a doctor's office is a private function, a private practitioner can make an election to accept or deny patients. In other words, they can choose to see who they want to see. If they don't want to accept Medicare patients, they can do that. If they don't want to see Medicaid patients, they can do that. If they want to only see people that have a major health insurance company like Blue Cross, they can do that. They can do any of that. Hospitals, on the other hand, cannot. Hospitals must take everybody by a rule. And so everybody does have access. For people that work for employers, the word affordable, again, becomes problematic because we're looking at premiums for a single person anywhere from $500 to $1,000 per month for a single person, depending on the kind of plan that you have. And for family coverage, it can range anywhere from $2,500 to $4,500 a month for family coverage, again, depending on what kind of plan you have. Is that affordable? No. Who's paying for it? The employer is. Okay, well, if the employer is a big employer and they're able to offer a Cadillac policy, they may have the wherewithal to do that. But if you're a small mom and pop shop with 10 employees, you're not doing that. Highly likely that you're not doing that. Just on the pure mathematics, you just look at those numbers and go, we can't do that. So affordability is a problem. And yet politicians on both sides of the aisle, we need to reduce healthcare costs. And I've been listening to this mantra from both sides of the aisle for 34 years, folks. It's like listening to Charlie Brown's teacher on a Peanuts cartoon. Just, it's noise. If they're really serious about it, they need to bring everybody to the table. And I say this with no glee. And everybody at the table has to say, what am I willing to give up? Not what do I want, what am I willing to give up? One of the fallacies of the Affordable Care Act, or Obamacare, was the idea was, if we can get more people into the pool, we'll be able to reduce the health care costs. Well, what happened was they squeezed the ratios from a 10 to 1 or 12 to 1 scenario, meaning that a 21-year-old might have been $100 and a 64-year-old might have been $1,000 on an age-based scale. So let's use 10 to 1 as a ratio. They squeezed that ratio to a 3 to 1 ratio, wherein your 21-year-old is now $400 and your 64-year-old is $1,200. And in the small group and individual space, I can promise you, you look at any schedule on an age-based arrangement and you're going to see a 3 to 1 ratio. You did not help the process, they hurt it, because they made everything more expensive. And the younger population who needed individual coverage chose to go, I can't afford $400 and maybe I'm making too much money at the time to get a subsidy. The heck with it. And this is before 2019. I'll just pay the penalty. And a lot of the younger people did, and so did a lot of older people, because as you got older, your price went up. and it went up every year. And prices have been going up every year for as long as I've been in this industry. Back in the day when I started, the cost of healthcare for a $250 deductible, 100% plan with a $5 drug card and a hospital-only PPO, no doctor network, go to any doctor you want to, was $35 a single and $125 a family. Fast forward to today, you're looking at premiums between $400 and $1,000 for a single person, depending on the nature of the plan. And for a family, like I said, anywhere from $2,500 to $4,500, depending on the nature of the plan. And for those people in the mid-market and small market, we're showing plans that are $2,000, $3,000, $4,000, $5,000, $7,000 deductibles, sometimes without copays to help with office visits or prescriptions. And while there may be some nuances like having a health savings account compatible plan, that sounds good on paper, but if you're taking a lot of prescriptions and you know you have an HSA compatible healthcare plan with a $5,000 deductible, you're on the hook for the first $5,000 no matter what, at the pharmacy, at the doctor, at the laboratory, at the x-ray, at the hospital, until you meet your $5,000. And because of circumstances, you're not able to set aside money into a tax-deductible medical savings account like a medical IRA, you are now on the hook for $5,000, and God only knows what your out-of-pocket is after that. Could be just $5,000, but it's likely going to be higher. So those kinds of plans are being sold today. So you do have access. Affordability is a huge question mark. And here's the other problem that I was going to go to. When the Affordable Care Act was rolled out, the idea was everybody needs to participate. Well, that fell apart like a Jenga or a house of cards. How'd that happen? Well, for starters, the federal government and the state governments all got together and said, oh no, we've got our own thing over here. We got 1 million people in our pool. We're fine. We don't need that. The unions across the country, we've got several hundred people or several thousand people in our union program. We don't need that. Our union people are fine. So all of a sudden, what sounded like it might work to help keep down the cost of health care because everybody was going to participate, it fell apart like a house of cards because you suddenly had a bunch of different segments of the population at the employer level, at the individual level, just to say we're not participating in this. I'm self-funded. I don't need this. We've got our own deal. We're big enough. We can do this ourselves. That's part of it. So when we hear the politicians talking about reducing health care, honestly, I don't know if they're telling the truth or not, or if they're just saying that to get elected. What I do know is I've been doing this for a long time, and I've seen health insurance companies roll out the carpet with layer upon layer upon layer of administrative pieces to help keep down the cost of health care, pre-authorizations for x-ray or labs or surgery, pre-authorization for a transplant, pre-authorization for an MRI, step therapy with prescriptions. Oh, you can't have that drug that costs $10,000 a month because we think you should do the one that's over the counter first and then step up to that more expensive one, and we'll let you know if you're approved for that after you've gone through what's called step therapy. They have all these layers built in, the insurance companies I'm talking about, that bring no value to healthcare but do bring cost. And this is not to besmirch the professionals that are doing that job. I'm sure they're doing a good job, and they're trying their best to keep down the cost of health care. But it added a layer of administration that, at some level, arguably, it's not working. Let me give you an example of why it may not be working. I was in Florida a couple months ago doing an open enrollment, and my rep, I won't say who, told me that there was a hospital system in Jacksonville, Florida, that wanted a 70% per diem increase over the next 4 years. Now, what did I say earlier about charity? The insurance companies are not in the business of charity, even though they do a fair amount of charitable work. They're not in the business of charity. They're simply a pass-through. So if the hospital system there got their way, the rep with the insurance company, after the meeting with the hospital system, would simply go back to the C-suite guys and the actuaries and the underwriters and say such and such hospital wants a 70% increase in their per diems. Readjust the numbers. And if the numbers get readjusted, they come back to be readjusted towards you and me as consumers, towards the employers who are paying a big chunk of the health insurance costs, and to those of you who are participating in the Affordable Care Act or Obamacare space. It also has an impact on Medicare. Medicare is where everything starts. Doctors who are accepting Medicare patients get about 35 cents on the dollar. If they're taking Medicaid, which is state-run health insurance, it's good for the very indigent people. They've got access, and generally it's free, as long as they can qualify from an income standpoint. But those doctors may only be getting 20 cents on the dollar. So how do you overcome that? If you need $1 to open up your doors and you're only getting 35 cents from the government to see your Medicare patients, you may raise your billables 200 or 300% when you negotiate the rates with the insurance companies, and maybe settle on $1.25. So you're getting 25% higher than the dollar just to make ends meet. And now I'm not saying that doctors don't deserve to get paid. By the way, with this hospital system, it's not just the doctors. It's their admin staff who have to process a lot of business stuff. It's their nurses. It's their electricians. It's the janitors. It's a whole bunch of other people that are in that food chain, not just the doctors. The doctors are the revenue source, true enough. But the nurses are what keep things going. The physical therapists are what allows some of those people to be able to go home and function on their own rather than being stuck in a nursing home or home care facility. The janitors and the electricians and the technical people have to know how the systems work so people are safe, patients are taken care of, and systems work. And the technology is such that we want the best MRI, the best PET scan, the best CT scan that money can buy, period. And so if you're faced with a medical situation, you want the best doctor and you want the best of medical care. Well, that costs money. And everybody in the food chain is asking for a raise. Everybody in the food chain wants better health care. Everybody in the food chain wants their 401k to be supplemented so that they can individually retire. It's a nasty merry-go-round. But Medicare is where things start. And when some of the politicians have said we need a single-payer system or Medicare for all, quite frankly, they don't know what they're talking about. In my humble professional opinion, they don't. And I would say to them, if you think it's so good, then I'll tell you what. And I'll leave it with this and we'll go to break. Tell you what, Mr. Congressman, Mr. Senator, Mr. Legislature, Mr. Bureaucrat, tell you what, you go on the Affordable Care Act plans, and we get yours. And we get your plan, since we pay for it anyway through our taxes, we get your program for 3 years, because it takes 3 years for a program to mature. And then I want to see how that went for you. It'll never happen, of course. But it's disingenuous for them to say this, in my professional opinion. It's complicated. Healthcare is messy. We all deserve to have it at some level. Access, we have. Affordability, hugely questionable. With that, it's the bottom of the hour. We're going to take a break here. This is 101.5 FM WLCB, Slade's Corner, Wisconsin. This is Your Insurance Corner, and we'll be right back after these important messages.